The acromioclavicular joint is primarily just a union between the clavicle and the scapula. This joint affords some motion, but very limited, and much of the motion is passive and just in response to the forces placed upon it. So the primary role of this joint is to absorb the forces associated with movement of the shoulder girdle and forces associated with, again, landing on an outstretched arm and other types of impacts that are applied to the upper extremity. So unlike the other joints we've looked at in this region, this joint doesn't really move. It doesn't have a group of muscles that allow it to move. It just moves passively when we move the scapula on the thorax or when we, again, have any kind of impact to the upper extremity. But this joint connects the clavicle to the scapula. Specifically, it's the acromion process of the scapula that attaches to the acromial end of the clavicle. So we can see this joint here, at the end of the clavicle where it articulates with that process on the scapula that reaches anteriorly and superiorly. The acromioclavicular is that bump on the top of your shoulder. If you palpate the top of your shoulder complex, what you're feeling is, the distal end of the clavicle and that acromion process. We could see that joint up here as well in this picture. So this joint is a plain synovial joint. So it's basically two flat surfaces that come together and interact with one another. Plain synovial joints are fairly unstable from a bony anatomy standpoint, but we do have fairly strong ligaments that help to hold this joint together. And then sometimes there is a disc present. I don't have any numbers on what the percentage is, but I think it's less likely, less common to have a disc, but in some individuals there is a disc between them, which would make sense because it is often, this joint often absorbs fairly significant forces. Basically, the scapula glides on the clavicle at this joint, and there is some motion allowed, again, so there is movement that occurs between these bones, but it is passive when we're doing other motions. The ligaments of the AC joint are important to note, and I want to spend a little bit of time kind of talking about them. The clavicle, right, is the primary attachment of the upper extremity to the thorax. So the entire weight of the upper extremity is basically suspended by the clavicle. So the clavicle, again, is attached down here to the sternum. So there's a lot of weight pulling the clavicle downward just from the weight of the upper extremity. So the ligaments of the clavicle, if you remember the interclavicular ligament went between them and so on, actually put a lot of upward tension on the clavicle. So the clavicle, is kind of spring-loaded to want to move superiorly. But it doesn't move superiorly because it's attached to the acromion, and it's attached to, which again is then attached to the humerus and so on, and therefore it's pulled downward. But the clavicle is under a fairly significant upward tension. So it wants to separate from the acromion. However, it can't because of the ligaments of the acromion, or acromioclavicular joint, and the ligaments that connect the clavicle to the scapula. So there are a number of ligaments that I want to mention. The first ligament is called it's actually a group of ligaments called the coracoclavicular ligament. Coraco refers to the coracoid process, which is this bony prominence here that's part of the scapula. So the coracoclavicular ligaments go from the coracoid process to the clavicle. And there really are two ligaments there, a trapezoid ligament and a conoid ligament. They're named for their shape. Again, but I think most importantly is to know this term, not the individual ligaments, but they hold the clavicle downward, right? Keep the clavicle, as I said, it's spring-loaded, keep it from springing upward. The acromioclavicular ligaments obviously go from the acromion process to the clavicle and directly support the joint itself. They are actually part of the joint capsule and hold this joint together. Again, providing support and stability to this joint as a whole. So we have a lot of ligaments that are kind of holding these two bones together. These ligaments are injured pretty frequently in athletics, especially collision sports such as rugby, football, and, any other sport where a person is impacted typically on the top of the shoulder. Often what can happen is we can have injuries to the AC joint, and those are called shoulder separations. So it's called, when you hear the term, you're watching ESPN, shoulder separation is an injury or a subluxation or a dislocation of the AC joint. And what happens in that aspect typically is what happens is the person is impacted on the top of their shoulder. Maybe they fall on their body. They're holding a football and they land on the tip of their shoulder. But they typically are going to be impacted here, which just drives the acromion downward, while the clavicle, as I said, it's spring-loaded, wants to move upward, and we get a disruption of this joint. The clavicle will then, if these ligaments are damaged, the clavicle will then ride upward and actually project upward. And people that have had an AC injury or a shoulder separation often have a bump on the top of their shoulder, and that's because the clavicle now rides slightly higher than it used to because those ligaments have been damaged. If we have a third-degree separation, then we also have damage to these ligaments down here potentially. And it can lead to a fairly unstable connection between the clavicle and the scapula. Luckily, this joint generally heals pretty well, and while the bones may not be perfectly aligned, they often will heal on their own. But so again, the ligaments of the AC joint are injured fairly frequently in a variety of types of activities, but primarily activities where there's a lot of collision and people running into one another. The motions that occur at the acromioclavicular joint, as I mentioned, they're basically passive. They occur passively when you move this region. And again, there isn't a lot of motion that occurs between these bones because the ligaments are so strong and stable. But whenever we rotate the scapula, whenever we do upward and downward rotation, we get a good bit of motion between these bones. And then we also, when we have winging of the scapula and tilting of the scapula, which I'm going to talk about in the segment on the scapulothoracic joint, we do get some motion at these between these bones as well. And as I said, an AC joint injury is fairly common in collision activities, and it's called a shoulder separation versus a shoulder dislocation typically involves the glenohumeral joint.